Ready for your day. We're keeping you up to date on what you need to know about the coronavirus.
And we begin this morning with a special tribute to our healthcare workers. Now, starting at 10 o'clock this morning, a C-17 military transport plane from the North Carolina Air National Guard will fly over hospitals all across the entire state. Now, the plane will first head west to Asheville, then turn east, going over Morganton, Hickory, Statesville. That's around 11 o'clock. That's on its way to the coast. And then around 1:30, it'll fly over Charlotte before landing at Charlotte Douglas. Now, Channel 9 has crews set up. They'll be all over the area to capture every angle of this flyover. Watch for our live team coverage. It starts at 1:25 this afternoon. And we told you the coronavirus really taking a disproportionate physical toll on people of color and minorities, and it's also hitting them harder financially, we're learning. The Associated Press is out with a new poll this morning, and it shows Latino and African American families having a harder time paying their bills than white Americans. The majority of layoffs during the pandemic, they're concentrated among lower income workers and those without a college degree.
And also starting today, Novant Health and Go Health Urgent Care Centers will start offering the coronavirus antibody test to anyone who wants it. Now, that test was developed by North Carolina-based LabCorp, and it can tell you if you've already had the virus, and that's even if you haven't had any of the symptoms.
Yeah, Eyewitness News reporter Anthony KUSTURA live for us uptown. Now, Anthony, there are some restrictions here and some caveats with this test.
That's right, John. Today, Novant Health is offering those blood tests at 17 of its urgent care Charlotte locations. And aside from some of the immediate answers people may be looking for, this could actually help health experts long term. The test could help with contact tracing, so health officials know whom you were in contact with while infected, and that helps trace hotspots. In the future, the test results could determine how effective vaccines are and gain a better understanding of who's susceptible to reinfection. Go Health says the accuracy is 90% or better, and it takes 1 to 3 days for results. Anyone can get tested unless you've recently tested positive for COVID-19, been in contact with someone infected with the virus, shown symptoms, or had a fever over 100.5.
They can take the antibody test and it will let us know if you have those antibodies to show that your body has developed an immune response. So that's a huge factor for this.
A few things to consider here. There are a number of human strains of coronavirus, I should say. So if you've had any of them, it could trigger a positive result, even if it wasn't COVID-19. And even if it does come back positive, it doesn't necessarily mean that you are immune to this. But Brittany, we know a lot of people are really curious to know if they've been exposed. Back to you.
Those questions. So Anthony, though a bit of debate over whether or not these tests even work. You just mentioned a couple of possible issues there. What is the official stance from the Food and Drug Administration?
Yeah, it's pretty interesting here. The FDA recently came under fire for allowing companies to sell these tests without proving that they actually work. Now, the FDA has officially reversed that policy, and they now require manufacturers to include data with their tests showing that they do work, and that is something that LabCorp has done here. Brittany?
Okay. All right, we'll keep an eye on it. I'm sure lots of people will be signing up, Anthony. Thank you. And this afternoon, Atrium Health is doing virus testing in 2 locations across Charlotte. The mobile units will be at Nations Ford Community Church Family Life Center and C.N. Jenkins Presbyterian Church from noon to 6, and you don't need an appointment. Meanwhile, our government reporter Joe Bruno talked one-on-one with Governor Roy Cooper about the state's testing ability and if it's enough to keep people safe.
We're now averaging over 5,000 tests a day. We hope to be getting to 10,000 tests a day soon. So we have more and more opportunities for people to get tested. And that's going to be a key anchor point for making sure that we are going through these phases and easing restrictions in a responsible way.
Now, the governor's phase 1 order, that begins tomorrow, 5 p.m. Stores are gearing up to reopen, and when they do, police say it'll be largely up to the businesses and to the customers to police new social distancing rules. Non-essential retail businesses like clothing stores, bookstores, they will be able to open after 5 p.m. tomorrow. Yesterday, CMPD said officers will respond to any complaints, but we'll have to rely on businesses to just limit the number of people that they allow in at one time. Now, for many small businesses, the reopening is crucial.
Yes, absolutely. It's a life raft just in time. Our online orders were decent, but nowhere near what we do on a daily basis with our doors open.
Now, Caroline Dowling says that she plans to allow only 5 customers in her Myers Park clothing store at one time and to make sure they're all wearing a mask. More than 20 million jobs now gone in just 1 month. A private jobs report by payroll company ADP shows the huge collapse in April because of the pandemic. Offices, factories, school, construction sites, they were all closed across the country, and these losses will likely continue through the month of May. The Labor Department's official jobs report for April will be released tomorrow. An economist believes that the report will reveal unemployment at a shocking 16%, up from 4.4% in March.
And for some students, it's not about the pencils and the paper, it's about internet access, and many of them still don't have access for online learning. Well, thankfully, help is on the way, and it's courtesy of school buses. Check this out. 280 more school buses will be equipped with Wi-Fi hotspots starting this week and then going out into rural communities. Avery, Burke, and Gaston counties will be among the first 30 North Carolina counties to get these hotspots. Last month, the North Carolina think tank NC Policy Watch reported more than 197,000 homes that don't have internet access. Some South Carolina school buses were equipped with hotspots last month, and we showed you Chester County buses with signs for the Wi-Fi server, got the password right there in the windows.
Well, starting this August, colleges and universities across the country will have a new set of rules when it comes to handling sexual misconduct cases. Education Secretary Betsy DeVos announced those new rules as part of the Title IX that prevents sexual discrimination in education. So this narrows the definition of sexual harassment, and it requires colleges to investigate claims only if they're reported to certain officials. Schools can be held accountable for mishandling complaints. Accusers will be allowed to question their victims through representatives during live hearings. Now, opponents say that will prevent some accusers from coming forward, and they plan to challenge the changes in court. We now know what you should do if the IRS sent stimulus money to a relative who died. The IRS says you should give back the entire payment unless the money went to joint filers and one of the spouses is still alive. In that case, you need to return the money if the person only to the person who passed away. The IRS instructions on how to give money back, that is on their website.
And a story of triumph surrounded by tragedy. A resident at the Citadel Salisbury infected with the virus will be returning home to her family. Barbara Thomas could leave the Citadel as early as next week. The nursing home has more than 150 cases, the highest number in the state. 17 residents there have died. Well, Barbara had to fight COVID-19 while isolated, and Thomas's family has been trying to bring her home for months, but well, getting around is tough. So look at this. Members of the community pitched in. They helped build her a ramp to get in and out of her house, and they are glad that she'll be home soon.
I didn't think it was good, but she fought it off. She's doing great. The doctor says her lungs sound better than they did in January.
Well, that is good news. Family members also tell us that Thomas recently took another COVID-19 test, and they are waiting for those results. If everything goes back well, then she'll be back home by next week.